So I approach my athlete, make sure there's no danger for me, making sure there's no danger for anybody else around. First thing I'm going to do is stabilize the head, and then I want to do my UABC, which is my primary survey. So U is at unconsciousness, so you're looking for the level of consciousness. Eleanor, do you hear me? Can you squeeze my hand? Can you feel this? She's unconscious. I want to call the ambulance, so I tell my teammate, can you go call the ambulance, please come back when it's done. And then you proceed with ABC. A is airway. You want to put your hand on the forehead, and then just open the airway by opening up lifting up the chin. And then you want to look for B, breathing. So you're going to listen, feel, and look for breathing for 5 to 10 seconds. I can see her stomach rising. I know she's breathing. C is major bleeding. I'm going to look, see there's no major bleeding, and I'm going to take her pulse at her carotid artery for 5 to 10 seconds too. I can feel her pulse. That's it. She has a pulse. I'm going to move on to my secondary survey, but it's just looking for major sign of injury. We start at the head, walk our way towards the feet. So what I'm going to do is going to gently palpate the head, look for fracture, deformity, bruising, or swelling. I'm going to look in our ears and nose for CSF. And whenever I go where my hands can't reach, I want to pull out to make sure there's no blood. So I gently palpate the face, the jaw, the back of the neck, the throat. I see to make sure the trachea is aligned, the clavicle. Then I'm going to come to the ribs. Just going to squeeze and press, make sure there's no deformity there. Then I'm moving to the stomach area. I'm going to go 4 quadrant. That's 1 quadrant here, looking for rigidity or any abnormal feeling. You're looking at her face too to make sure that she doesn't express pain by crunching her face. Then you're going to push on her hip from the outside towards the inside, looking for anything that's abnormal. Doing the same with her leg, deformity, swelling, crepitus, all the way down. Then you want to take the pulse down at the posterior tibial artery. Can you feel this? Can you move your toes? And technically you should take a cap refill here, but she's wearing socks, so do it some other time. Go to the other leg, same thing. You feel this? You wiggles your toes, cap refill, go back with the arms, pulse, and you go and you don't forget the arm on the other side. You feel this? You squeeze my hand and you do cap refill. And that's your primary and secondary survey.